There are many results and outcomes of patient education. For example, for healthcare professionals who practice patient education, there's a decrease in lawsuits that has been shown for healthcare professionals who practice patient education. This is because patients are aware of their at-home instructions and they are less likely to experience a re-injury, and they are less likely to misuse their medications. There is an example in the book, Patient Education, You Can Do It, by Kendra Lewis, and she discusses her experience as a nurse and an incident she encountered of a patient who underwent a hip replacement, and he was instructed on how his sitting position should be, but not how low the chairs could be. So he ended up sitting in a chair that was too low, and he popped his hip replacement completely out of socket. And this is a risk for a lawsuit for healthcare organizations. Crutch use is also the cause of lawsuits for healthcare organizations because if patients are not instructed correctly on how to use crutches, they are likely to re-injure themselves, and this can be at a loss for the healthcare organization. Increased morality is another outcome for healthcare professionals who practice patient education. This is because they're practicing moral behavior because patients are entrusting these healthcare professionals with their lives and their conditions, and it is the responsibility of the healthcare professionals to not betray the trust of the patients, and they are doing so by having the best interests of the patient in mind and educating them on their conditions and the possible paths they can take. Thirdly, an outcome of healthcare professionals who practice patient education is increased ethicality. This kind of goes along with increased morality, but the ethical behaviors of healthcare professionals are being practiced through patient education because these professionals are treating patients as people, not just as patients. And lastly, for the results of patient education for healthcare professionals is an increased professionality. It is also discussed in the book, Patient Education, You Can Do It, that it is a requirement of all healthcare professionals to practice patient education. And then the results and outcomes for patients who experience patient education is, first of all, there has been shown to be an increase in improvement of health outcomes. This is because patients are more aware of their choices for treatment, and they can better choose the choice that is best for them. They also are more aware of how to use their medications and the risks and benefits of everything. And this is also has been shown to increase success of at-home directions, which also improves the health outcomes of patients. And lastly, there is an improvement of self-efficacy with patient education. This is because doctors take the time to sit down with patients and discuss with them their health condition and how they can improve their health and how to keep up their health. And because of this, patients have the belief that they have control over their health condition, and there has been shown to be a decrease in diabetes, coronary heart disease, heart failure, and rheumatoid arthritis because of this.